I'm Betsy Rust, and I'm pleased to present this video series exclusively designed for healthcare executives to hear from peers about top trends that will improve your bottom line. Be sure to watch your inbox for next month's edition. We'll sit down with another one of your peers who is revolutionizing healthcare. Thank you for watching.
We try to do things as efficiently as possible. Ultimately believe that to get good outcomes, we have to bring the services to people. We don't really have another choice. We are trying to partner with managed care organizations to develop innovative funding models that really allow us to fully cover our costs of delivering care in the community to the people who are hardest to serve. So we're working with a couple payers on bundled rates that allow us the flexibility to really go where people are and deliver the care to the hardest to serve people who are the hardest to engage, hardest to find, people who use hospitals and emergency departments a lot. And we find them and engage them into care, and that different payment model, that bundled rate, allows us to do that. Where we want to get to next is a bundled rate with performance bonuses or performance guarantees that would result in bonuses. And then beyond that, we want to keep moving toward delivering quality metrics, outcome guarantees, and then to a fully risk-based contract. It's very difficult to measure outcomes for people with behavioral health conditions because you can't take a scan that says, okay, their schizophrenia is gone. It's an ongoing chronic health condition that can be managed. People can get their lives back, but it's tricky learning how to measure the outcomes. We did a program for people who are the highest utilizers of inpatient psychiatric hospitals, where the insurance company sent us the list of 50 people who are going in the hospital at very high rates, as much as 30 times a year. And we went and knocked on doors and talked to neighbors and called family contacts, any way we could. We found those people and engaged them into care by asking them what did they want, what is going on in their life that's driving those kind of things where they're going to the emergency room and into the hospital once a month or more often than that even. And people respond when you start with talking about what's going on in your life and what can we do to help you get your life to be what you want it to be. People respond and engage into the care, and that's what I think has been the most impactful for people who had been really kind of not using the system in a way that is ideal and not helping them get better either. So we basically lose money on every fee-for-service encounter we have of this type in the community where we go out and see people. So the positive impact for Thresholds is that we developed a bundled rate that actually covers our cost and allows us to do things like try new service models, go into new geographic areas that we could not expand into under a fee-for-service model. So it's helped our bottom line in the sense that it gives us a lot more flexibility, a lot more predictability of revenue, in that the rate that we're getting paid is based on our actual cost of delivering the care, which allows us to do the work we do. So we have the results of our pilot, and we have pretty good data in showing that the cost was moved from hospital care to community care. The challenge around that question is that we don't control the data, so we don't have claims data. I think where states like Illinois need to move is to the health home or the behavioral health home for this population. So if a behavioral health provider like Thresholds could sort of own the people's lives and manage their lives and be responsible to make sure they get their mammograms and they get all their follow-up care and they get good primary care and they get coordinated and integrated behavioral health care, then I think you have an opportunity for really moving forward. Providers need to keep working with payers and focus on value, focus on outcomes, define those together, and kind of work in a trusting relationship to move that forward toward good value-based care.